start. My name is Jill Kagan, and I am Program Director of the ARCH National Respite Network and Resource Center. Before we get started, I want to introduce Emily Turner. She's our GoToMeeting facilitator today and will provide a brief overview of your GoToMeeting screen and the control panel. So Emily, thank you.
Good afternoon, everybody. So before we get started, I just want to review a few housekeeping items and let you know how you can participate in today's webinar. So right now, you should be looking at an example of the GoToWebinar attendee interface, and this is made up of two parts. The viewer window on the left, which allows you to see everything the presenter will share on their screen, and the control panel at the right. Within the control panel is how you can participate in today's webinar. By clicking the orange arrow, you can open and close your control panel. From the View menu, you can also set the control panel to not auto-hide when inactive. If you prefer to keep your control panel open during the presentations, uncheck Auto-hide the control panel. The audio pane provides audio information. You will need to dial in with the number and the access code provided in your control panel, or you can, if you prefer, you can listen to the audio through your computer speakers. Due to the high number of participants on the call, all callers will be placed on mute. You have the ability to send any questions you may have to our webinar staff through the questions pane. Simply type in your question and click send. We will answer as many submitted questions as we have time for during the Q&A portion of the presentation. And as a final reminder, today's webinar is being recorded, and a link to the recording will be sent via email once it is available for viewing. That's it.
Thank you very much, Emily. Reiterating what Emily just said, because of the large number of webinar participants, your phones have been muted and will remain muted for the entire presentation. That means you can hear us, but we can't hear you. So if you have questions or comments at any time during the presentation, as Emily said, please just type them into your question pane on your control panel. If your questions are related somehow to difficulties you might be having with hearing or seeing the webinar, Emily will try to address them immediately via that chat box on your control panel. There will be time, as she said, at the very end of the presentation to respond to questions about the presentation itself. It would be very helpful, if you don't mind, if you identify yourself when you type in your question and let us know where you're from. Emily will then read the questions and have the presenter respond. If we don't get to your question while we're still live, we will try very hard to respond via email to all the questions that come in following the webinar, but be a little bit patient with us. Last time we had quite a few questions, and it took a couple of days to get through them all and respond to them. In addition, if you're not able to stay for this whole program, or if you had a colleague or two who couldn't join us today, the webinar will be archived at the ARCH website, again, within a few days. You'll be receiving an email after the webinar that will tell you how to connect to the archived program. Also, when you close out of the webinar today, there will be a pop-up evaluation that we really strongly encourage you to complete so that we can be as responsible as possible around future programming. We are so very delighted that all of you could join us today on this very special webinar on marketing respite to family caregivers, moving beyond awareness, with Alicia Blater, who I will introduce in just a minute. But before I get started, I just wanted to mention how honored ARCH is to be partnering with the Family Caregiver Alliance in San Francisco to bring you the technical assistance centers on caregiving and lifespan respite funded by the U.S. Administration on Aging. FCA brings to us a wealth of information and research on family caregiving issues. Just a few of the services that they do have available include an Innovations Clearinghouse, a 50-state family caregiver navigator, which is a web-based storehouse of consumer information, numerous policy briefs, fact sheets, research reports, newsletters, In fact, together, ARCH and FCA publish a joint newsletter for the Caregiving and Lifespan Respite Networks, and we welcome you to subscribe to that newsletter, and we'll be sending out follow-up information to you on how you can subscribe if you haven't already done so. We are extremely honored today to be joined by Greg Link, who is the Aging Services Program Specialist in the Office for Community-Based Services at the Administration on Aging, and he was kind enough to agree to say a few words of welcome. So thank you, Greg. You can go ahead.
Hi, thanks, Jill, and welcome to everyone who is on this webinar. I'm particularly excited about this particular subject. I think that it's reflective of the place where many of the current 24 grantees for the Lifespan Respite Care Program have come in their program development and the work that they've been doing in the grants that have been funded by AOA. And so I think this information will really help folks think through plans for marketing and disseminating of information, which is absolutely critical as we work to foster, caregiver self-awareness and understanding about respite. So thank you, Alicia, for agreeing to present, and I look forward to the content.
Thank you, Greg. For those of you who may not be familiar with the ARCH Resource Center or with Lifespan Respite programs, I just very briefly wanted to share a little bit of background on both. ARCH is now charged with providing training and technical assistance to the current 24 state agency Lifespan Respite grantees and their partners, many of whom I hope are on the phone with us today. We also just heard from Greg before the call that AOA is getting ready to announce the new grantees any minute, so we're very eagerly awaiting that. We also help assist with training and TA with the partners to the Lifespan programs, including our 35 state respite coalitions, other respite providers, community and faith-based agencies. We also help family caregivers if they're looking for providers through our National Respite Locator service. Grants funded through the Federal Administration on Aging to the states for Lifespan Respite are used primarily to help states build or enhance these coordinated respite systems that we hope will be helpful to families, regardless of the age or condition of the person that they're caring for, to access affordable and quality respite options. ARCH has offered a continuing series of webinars, which are all archived up on our website. Like FCA, we also provide information to the public and to our grantees through respite fact sheets, issue briefs, guidebooks, and many other tools. But since our inception in 1990, we've really been seeking and disseminating the best practices that we know of in respite services to ensure that family caregivers as well as care recipients have very safe and meaningful respite experiences. We've even dabbled a little bit in the area of marketing and public awareness. That is the subject of our webinar today. One of the first awareness campaigns that we came up with at the very beginning was this theme of asking for help as a sign of strength. We developed through the 90s, we worked with a public relations firm in the late 1990s to come up with this new theme, relax, recharge, relief for respite, and protecting and supporting families for crisis care. We even had this logo of the heart in the hand that we disseminated widely. And some of the other tools, a video that we still have available that any of you can use called A World of Relief, which explains the value of respite and crisis services across age groups, as well as some other materials, including a public awareness guide, book, and copies of these posters that I showed you earlier. Many states and local programs have continued to use these approaches and the materials we developed to help promote them. But as we expanded the population that we were serving from children to all ages across the lifespan, our messages really need to change, partly because we have expanded these populations but I think even more so because we've learned so much more over the last decade about family caregivers, about the barriers they face to accessing respite, and the ways to overcome these barriers. And we hope that our messages that we're developing will be reflecting this new knowledge and insight that's come to the forefront. Over the next year, ARCH hopes to work with all of you through a more deliberative process that Alicia is going to be discussing today to develop additional tools that will help you with your marketing directives. To help us regroup and move forward, we're so pleased today to have Alicia Blater with us, who has the perfect background to help us get started again. Alicia Blater earned her bachelor's degree in public relations from Brigham Young University and worked for 10 years in media and healthcare communications in and around Salt Lake City, Utah. She is accredited in public relations from the Public Relations Society of America and credits those years spent in home care, hospice, and hospital services as positive training ground for her eventual transition to aging services. Alicia has a post-baccalaureate certificate in nonprofit management and a master's degree in gerontology from the University of North Carolina at Greensboro. Her earlier positions have garnered her local, state, and national awards for her efforts to increase vaccination rates and emergency preparedness action among older adults. She is currently employed by the North Carolina Division of Aging and Adult Services as the project director for the North Carolina Lifespan Respite Project and the state consultant for the Family Caregiver Support Program. So welcome, Alicia, and I will pass the keyboard and mouse on to you. There you go.
All right. Well, I am happy to be here, everyone. And hopefully what we have to say here will be of value to everyone that's listening in. Let me tell you a little bit about what North Carolina has been working on. In North Carolina, we're one of the original 12 states that was presented with the Lifespan Respite Grant. And what we've done with that, as we were looking at the beginning of our project and what we knew we needed to do, we knew that marketing was going to be a big element of it. So what I'd like to do today is walk you through not only the process of marketing, public relations, advertising, some of those terms and what's the same and what's different as we go forward, but also then go into the framework that we are starting to use here in North Carolina. We're still in the process of it. We've identified and worked through all of the process and are now in a mode where we're going to be turning things into materials. So it's exciting to be able to share, and we'll get started and tell you about it. So where do we begin? You hear, obviously, we throw around terms, marketing, public relations, advertising, publicity. How are they the same and how are they different? So let's spend just a moment talking about kind of our communications 101 here. So public relations helps an organization and its publics adapt to each other. You know, we often hear about enhancing and maintaining an image or managing communications between an organization and its publics. Really, engagement and relationship building are the key components of public relations. Maintaining that ongoing public relations efforts helps sustain companies through crisis and builds a base of support for all other communications efforts. In marketing, we often hear exchange and value. In an effective marketing exchange, the consumer gives something, the company or organization gives something, and you both get something in return. We want to be able to be doing activities and processes and communicating and delivering and exchanging things in marketing, and that's primarily what we're going to be talking about today. With publicity and advertising, there's a few things to keep in mind, the differences. It used to be that people talked about all publicity was good publicity, but we know that's not particularly true, particularly now as everyone can get in the papers or get on YouTube and all kinds of messages, and not necessarily everything that is on there is beneficial to the company that it is representing. The key point here is understanding who is in charge of the communication and the impact that has on your audience. With publicity, reporters and writers are deciding what is said. In advertising, the business or organization is deciding what is said. As you know, typically you're purchasing that spot. You're buying the space or you're buying the time on air or on a billboard. You're in control of what is said. If the message is coming from a credible source and is consistent with what you would say yourself, the audience will believe them more than they believe you. So that's why a lot of times people talk about if we can get good publicity, that's beneficial because we have more credibility when it's coming from outside sources that people trust. And of course, sales is blending many of the above to close the deal. This is a kind of a simple story that I found and adapted, and I thought it was a good way to talk about how these elements come together for a sample situation. If a circus is coming to town and you paint a sign saying circus coming to the fairground on Saturday, that's advertising. If you put the sign on the back of an elephant and walk it into town, that's promotion. If the elephant walks through the mayor's flower bed and the image goes viral, that's publicity. If you get the mayor to laugh and respond favorably to key contacts about the circus, that's public relations. If the town citizens go to the circus and you show them the entertainment booths, explain how much fun they'll have at the booths, and answer their questions, that's marketing. Ultimately, if they spend money at the circus, that's sales. So all of these different pieces you see, they're all related, and they all have a place, but each of them are doing something slightly different to be able to get you to your end goal. So where in all of this does awareness come into play? It's very common to hear a statement in a meeting like, we need to build awareness. I do it all the time, even myself, and I know I'm supposed to use different terms. We also put in proposals and area plans that we're going to build awareness. I think many of us in Health and Human Services were reluctant to come out and use the words advertising, sales, or marketing because we don't want to come off that we view what we offer as products or that we're trying to sell something. We're in a service industry. But in reality, we do offer a product. Whether it's a home-delivered meal, an hour of in-home aid service, an overnight stay in a facility, the service of a case manager, or something else equally vital. If you look at the definition of awareness, you'll see that it only requires a state of elementary or undifferentiated consciousness. As consumers, we probably won't rush out to buy or participate or refer something for someone else because we simply have a knowledge of it. It takes us a little bit more. So I want to say beware awareness. I think that it's a great initial step, and a lot of us, we have to come to some conscious awareness of what we're doing. We have to have a knowledge of it. It's a great initial step. But if we want people to act, we need to go a little further, and sometimes a lot further. You've heard that knowledge is power. That power comes from what we do with what we know. So why is it that we communicate? We don't communicate just to make people aware of our organization or product. We want them to do something. We are, in our fields, we're getting them and asking them maybe to donate. We're getting might be them to support an organization, to join a committee. Maybe we need volunteer workers, and we need to be able to have a successful volunteer program. So we're going to be specific and ask them to do something. We might ask them to refer. We might actually ask them to become consumers of our services. Here's one campaign I really think is fascinating. I'm guessing everyone on this call is familiar with the Got Milk campaign. It's something that we've seen for many, many years and very recognizable. By the early 1990s, milk sales had declined nationally. California was one state that was seeing a bigger drop in milk consumption than some of the other states. And they saw that drop in revenue as consumers switched to Coke, Snapple, and Gatorade. So when the California Milk Processor Board turned to their advertising agency, Goodby, Silverstein, and Partners, who came up with the Got Milk tagline and the advertising campaign. These were nicely done advertisements. They were well-known personalities. But did it lead to behavior change? If you look at this, this table here, I think this is really fascinating. If you look at the blue line, you'll notice that awareness from 1994, and this obviously just goes until the year 2000, and we'll talk about further later, we see that as the media buy, so as they spent more money on paid advertising, went up, so did the awareness. We had more and more people that were aware of the campaign, They were aware of the effort to get people to drink more milk. They'd seen it. They knew the phrase. But the green line across the middle is the consumption. So while the level of awareness of milk grew, the sales stayed flat. Communication alone did not lead to the behavior change. The campaign as it was did not fully convey benefits that were important to buyers. It did not involve those structural changes that made it easy to buy the product. So you're probably wondering, well, why did they stay with it? We still have this campaign. In fact, it's bigger than ever. The campaign did further research to understand what benefits were important to consumers and when and why they thought about buying milk. It made changes at the sales point of purchase in stores and changes in its promotional messages. If you think about it, it was only in this last decade that we've had milk available in single-serve containers, in fun colors, in strawberry flavors, in chocolate flavors, in boxes, lots of different kinds of ways that consumers could purchase and use milk. And that came from their studies to show what were the barriers to them consuming more milk and what product and point of purchase could they change to make that easier. So all of this came into play for fun and friendly packaging, that flavored milk, those individual serving sizes. We also saw that the phrase itself just grew phenomenally. The awareness of that phrase has gone through the roof and made millions of dollars in licensing, things like T-shirts and all kinds of things with the Got Milk phrase on them. But one of the things they also did was pay more attention to what consumers wanted from milk. If you look at these two ads, one with Harrison Ford and one with Taylor Swift, the one with Taylor Swift is definitely targeted toward teenage girls with the new information and research that's showing that milk helps maintain a leaner body mass or linked to healthy weight. And so that's why, hence, Taylor Swift telling teens to drink milk to stay lean. They tied those messages together. So we'll continue to see this. This Harrison Ford ad actually is the one that just came out in this last week. We're seeing more and more television commercials. There's a whole book on this entire Got Milk strategy campaign where you can learn about all kinds of strategies that were involved in marketing and the partnerships and the huge connections that they made to be able to make this campaign continue to be successful. So I think that's really fascinating. But marketing is more than a great slogan. It's wonderful if you can have one, and it can do a lot for you. But focusing on the process can lead you to an effective slogan and an even more robust campaign. So obviously, lettuce is an important part of a salad, but it's not the only part. Now we'll go on to another product example. And if you'll notice, all through here, it's showing pictures of food and beverages. So I don't know if we were hungry when we all developed this or what this is about, but it's good products that I think we can all relate to. The 4 Ps of marketing. Traditional marketing after 1960 incorporated the 4 Ps of marketing: product, price, place, and promotion. It's another strategy that people look at. Recently, a 5th P has been added to represent the people who you're targeting. And I think that strategy and that approach is a little bit closer to this framework that we'll talk about that we're using here in North Carolina. And this approach can be very successful, too, where you're really thinking through what is our product. And I think that's a good exercise with Respite, is to take some time and try to define what is the product. Is it the actual service? Is it what comes because of that? What benefits do we get from the product? And how are we promoting it? Where are we putting that place? And you'll see these elements come into play as I continue. So remember, marketing is an exchange. And if you take that Pepsi and you're trying to compare that to an exchange, when someone purchases a Pepsi, they're giving up some money. Maybe it costs them $1. Maybe it costs them $1.50. It took some time. They had to go locate that, and whether it was in their home and they had purchased it previously, or maybe they're at work and they needed to go pick that up somewhere else. So we're having money and time and convenience. In exchange, the advertising is telling us that we're going to get a Pepsi. We're going to get a taste or a thirst quencher. We're also, if we're participating in the campaign, we're also going to have fun, and we might get a youthful feeling. And I think it's funny that some of the advertising implies that we're going to get a boyfriend or a girlfriend out of that, or a great social life. And the company, in exchange for what they're giving us, they're going to get increased profits. They're getting something from us as well. So if respite is a product, think about what someone gives up. A care recipient and or the caregiver may give up privacy. They might give up some control, maybe some financial, if they're paying privately, certainly, and time to arrange those services. And if you think about it, these are surprisingly similar to what a consumer gives up when they buy a Pepsi. That time, the convenience, money. As Arch and the Family Caregiver Alliance has helped us understand more about using respite effectively when planned correctly, like we did in our last webinar, respite too could give us a more youthful feeling, fun, and while maybe not a boyfriend or girlfriend like the Pepsi ads hint at, it could give a caregiver time to pursue a social life and enrich a care recipient through greater outside connections. I think that's an example of how we can be applying a framework with the marketing and exchange to what it is that we're doing with respite. And let me talk for a minute about the Behave framework. Now this is the nuts and bolts of the process we're undertaking here in North Carolina. The Behave framework was shared with us at the Division of Aging and Adult Services by our Division of Public Health. Our Division of Public Health here in North Carolina have a social marketing team who were looking at tools often used to guide behavior change. And they were going through this process with some other departments and divisions in the state of North Carolina. We had heard about this presentation and got involved with it and wanted to see if we could take a similar model that they were using from an organizational behavior standpoint and see if we could tweak that to have it include elements that would be beneficial to behavior change related to marketing and to respite. And so we pulled that into our Lifespan Respite advisory team and started working with it and went through this process over several months. The Behave framework was developed by the Academy for Educational Development and their Center for Social Marketing and Behavior Change. Now we adapted it, and what you'll see is the adapted version. But the premise of the tool is that asking the right questions leads to the right answers when an organization is facing a particular challenge. So why not look to the challenge of respite education and adapt the framework to include a marketing and media focus? And that's what we did. The framework involves several key elements, and these are four of the main ones. Target audience, who are we trying to reach? The action, what is it we want them to do? Understanding that behavior change comes when people have something that benefits them, and the barriers that keep them from acting are reduced. So that's our why. And then we also have messages, activities, and media that shows the benefits, it shows how to minimize barriers, and it helps us reach that target audience with what we want to share the message with them. So who is it that you want to do something? When we are talking about a target audience, we want to look at specifically who they are. When I was in college in the public relations program I was in, a professor instructed us to target an audience of one, meaning that we would be more successful if we understood how to really pinpoint an audience. Today's social media options allow us to target an audience of one very easily, but we're not all participating in those, and it's not always where we want to be able to reach the groups that we're trying to reach. So who is it we want to reach? Is it spouses? Is it adult children of aging parents? It might be parents of children with disabilities. It might be other organizations. These are all audiences that we all work with on a very regular basis. But there are important differences between them. Will the same messages work for all of them? And do we have an opportunity to ask them? Now, a traditional approach to marketing tells us that people are pretty much all alike. We can create one approach for everyone. We've all heard this is something created for the general public. And for some things that might work. For people that have needs in a lot of different audiences, it's nice to have a segmentation approach, and that's certainly the one that we think is most successful related to what we're doing. So the segmentation approach assumes that people are different. Therefore, we want to create those different approaches. The example that I'll show is about newly diagnosed individuals diagnosed with hard of hearing or hearing loss that are over age 65. So the traditional approach says do the same thing for everyone. We target the general public. And if you notice, even though we have hard of hearing individuals over age 65, the people that are hearing those messages are going to respond to them differently. So one group may tell you, my parents need this, but probably won't call. Can I call for them? Another might say, I would like some assistance, but it is hard to leave the house. That's a barrier that they're identifying there. Another group may say, I want to call them. Now where is my notepad? So it's a group that they hear it, they're ready to respond. Now what can you do about that? And then we might have another audience that says, I don't need any help. These are all typical to what we would see in the services that we're offering. So this is a prime example, with the problem with comparing apples to oranges. So we want to split that. We want to say that one particular group, the one who has my parents need this but probably won't call, can I call for them? How do we reach them? Can we clarify and have a message that's specific to those adult children, and clarifying that, yes, you can call, and we specifically are prepared to help you when you do. Another group that has expressed some access barriers, we want to lower that barrier by going where they're located. And we want to say that in our messages. We don't just want to have the fact that we know we've lowered that barrier. We want to make sure that they're comfortable and confident that when they try to access us, that they can. And so in our message, we want to be able to relate to that and actually tell them we have lowered this barrier. For the group that wants to call and they're ready to call, one of the things is maybe we can repeat the information often and in many ways, because they might have that idea and decide that they want to act on it, but it needs to be easy. We need to make it easy for them to do that. And one way we make it easy is through repetition. And then the group that says, I don't need any help, have stories of individuals with similar attitudes benefiting. That's one way to kind of be able to segment your audience and get a little more involved, a little more in depth as to which each of them, what their needs are and what they want. With audience members or targets that say we don't need any help, oftentimes testimonials is a great way, and that's where it says have similar stories of individuals that they've benefited, and so that they're able to see that people like them have benefited. They'll be able to take advantage of that as well. One of the things that I see with approaches to marketing, we don't have a lot of money. A lot of our organizations, we're not employing an advertising agency. We don't have funds to maybe produce 5 or 10 different materials for a similar or for all different audiences. So we need to be very cautious, or I guess thoughtful, mindful about what it is that we're doing. So maybe we'll do a brochure or a piece that includes all of their audience in this one piece, and we'll have a portion for caregivers, another for care recipients, another for providers or volunteers, and so on. The hope is that everyone reading it will be able to pick out the part that applies to them and then determine the action they are expected to take. A second approach is to develop something generic that we hope will apply enough to enough people that we'll get a reasonable effect from our efforts. Some organizations get lucky with these approaches. Marketing research and kind of the framework that we're developing, we're trying to find ways to highlight and segment those audiences as much as possible so that we're able to more appropriately target. And hopefully in the long run, that also is more cost effective. So after we do our audience segmentation, after we look at who is it that we really want to target, we look at behavior. What do we want our target audience to do? Why aren't they already doing it? And what will they receive if they act? So we kind of mentioned this before, and I'll show you in the framework how it all comes together. So what is it you want people to do? Do you want them to call your program? Do you want them to schedule a tour? Do you want them to ask for a presentation at their office? We all know that simply telling people what you want them to do doesn't mean they will do it. Trying to make that action reasonable and easy requires some understanding of the factors that determine this behavior. And that gets into what else do they need besides information to do that. So what are the factors? What are those kinds of things that they need? Externally, there's a lot of things that we have externally and internally that contribute to what decisions we all make individually. Think about the external factors that you may be contributing to or that we're contributing to in our services for respite. Do you have policies about the number of hours a client has to use respite at once? How easy is it to schedule a last-minute appointment? How easy is it to change that appointment at late notice when the respite plan unravels? Can caregivers reach you when they need to you? I notice that most of the caregiver contacts that I receive are by email. They're going to be at night or on the weekend. If it's a phone call, it's more likely to be first thing in the morning or at lunchtime from a working caregiver. And it may take us 2 or 3 days to get back and all the information to them, being able to catch them when they're available based on when I'm available. And we see that kind of comments across the state that we notice that people are needing us at not necessarily those 9 to 5 hours. And as we're providing respite services, have we made it easy for clients? Have we made it easy for caregivers and care recipients to be able to reach us? And so are some of our external policies or that access, are they playing into how hard it is for consumers to actually access us? Are we setting up our own barriers? I think applying person-centered and consumer-directed principles to respite can help alleviate some of these external factors. I think a lot can be learned with ongoing discussion and being willing to be flexible. One of the things I'll probably say a couple of times even more through this is that it is so beneficial to have actual caregivers and people who work with caregivers on a daily basis involved in your process. Caregivers of all situations, meaning that you're having caregivers that are taking care of spouses, caregivers that are taking care of older adults, caregivers taking care of children with disabilities, caregivers that are foster parents or grandparent, relative caregivers, taking care of a child. All of these, we say that caregivers have a lot of similarities, but they also have a lot of very unique needs about them that come through much more clearly when we let them talk themselves and tell us about why is it that you used respite once but you didn't use it again. What was different about that? Was it something that we could help you with? Was it something that was difficult? And you start to hear what those barriers are, but you also start to hear a whole lot of information about what it is they're seeking respite for or seeking caregiver services for, and it really speaks to the benefits. So then we have internal factors, and these are things that are harder to change. So much of how we operate in our families and how we invite or discourage outside help are tied into these internal factors. I think this is another good area to apply consumer-directed principles whenever possible, to acknowledge and work in conjunction with them. Another thing we stress in public relations is that perception is reality. And so you see here perceived risk or perceived consequences. Sometimes people would say, well, we just need to tell them that's not so. But a perceived risk or a perceived consequence is a real risk or consequence to those people who are facing that. So until something causes the individual to form a new perception, this is reality. So we definitely need to take into play what all of these things are happening internally and know that there's just some things you have to accept and try to identify and overcome through a benefit statement as opposed to working to take down that barrier. So what barriers to the behavior exist? How can you minimize them? The portion of the process, this is where we start to identify barriers specific to our target audience, and then we look at what benefits we can offer that may outweigh those barriers. You know, I don't think what motivates them, and this has really, I think, been a fascinating discussion for us, is, you know, what is it that they're trying to accomplish in their caregiving role? What is it that they want for their care recipient? Helping the people they love is certainly very important. If it's a parent caring for a child, securing long-term plans for that person, keeping their pride, being independent. And it's not just pride or independence for the caregiver. We know it's also pride and independence for the care recipient. And this bottom phrase, how can you make the behavior fun, easy, and popular, that's a very common, when someone is trying to market a product or sell a product, we often hear, well, how do you make it fun? How can you make it easy? You know, everybody wants to do something that's fun or easy. I don't think we outgrow the interest in things that are fun, easy, or popular, particularly the easy part. When thinking about the action you want your audience to take, how can you make it easy? I think that's a huge challenge for many of us when we work in what appears to be a very complicated system to our consumers. Unfortunately, I think a lot of times it's not easy. It's not easy for them to know immediately where the service is coming from. They don't know where to call. They don't know who to ask a question of. Many of our systems, when we're delivering respite, it may be through a couple of different channels that that person is receiving that service. And so, for example, if they are working through an area agency on aging who set up a service that is coming through the Family Caregiver Support Program, and then it is contracted through a home care agency, that home care agency is providing the respite in the home. The client, the caregiver, is having that experience with the home care agency. And then we ask a survey, or we do something to try to find out how we're doing, and we ask that from the area agency on aging. And a lot of times the clients or the caregivers will say, well, I don't know them. I didn't know that I was receiving my service from them. And so this segmented approach that is just factored by what sometimes that it needs to be by different payer sources and how things are organized, sometimes make it, we put up barriers ourselves that are not fun, easy, or popular. So now, after all the previous steps, we'll talk about messages. It's very common, I think, for all of us to rush to the message or the channel portion of the plan and skip the previous steps. It's understandable because we're busy and we're trying to produce and distribute something tangible. If you're like me, it's fun to bounce around possible slogans or talk about what a brochure might look like and where we're going to place it. We may get a call that a set of billboards or a drive time radio package is available and we need to act fast. There are times you do need to act fast, and this process can be undertaken quickly if needed. But our experience here is that taking it slow has gotten us some insights we don't think we would have had otherwise. A couple of times I have presented something similar to another group here in North Carolina. Anyone who's been through a process like this or a behavior change process says the most beneficial thing was to slow down and to think seriously with a group of people about each of the steps, and that it's surprising when you get to the end of it what you came up with, because it wasn't what you thought you were going to have when you started. By including caregivers and people who work daily with caregivers, like I said before, throughout the entire process, we hopefully have been able to better understand what benefits our audiences want from our services. This gives us a way to check their needs against what we think we're offering to them and asking from them. So as we talk about messages, there's a couple of things that I like to point out here. We're busy. We don't have a lot of different ways to get the messages, so we want to be clear and concrete. We want to say things that make sense to people. I think this bottom part, following safety precautions, can reduce foodborne disease transmission. You'll see that on the slide. I think we talk like that. For caregiving services, we use words like transfer and ambulate, ADLs and IADLs, discharge plan, and other terms that may be putting more of a distance between us and the people who need and want our help. I think these kinds of things have stuck with us over time. I know that phrase, keep hot food hot and cold food cold. I know that phrase, wash my hands after handling raw meat. I mean, these are the kinds of things that stick in our memories, we can remember, and it's a direction. It's something that we can follow. Tell the audience what you want them to do. Call us today. Come in for a tour. Please tell your friends about this service. Act now. Sometimes I think we don't want to be bossy. We don't want to come off pushy. This is, many of us are doing what we think are softer services, and so we tend to undersell them. We undersell ourselves, and I'm certainly not saying that we need to take this field and turn it into exactly a business practice model, because there's certain parts that just don't fit, and we are in the business of serving people, and at the end of the day we're in this because we enjoy and want and care about serving people, and I think that's really important that we remember, and I think this process helps us to focus on that. Also important to focus on the positive. How many times do we run to say, don't do this or don't do that, but we want to focus on the positive, and this example of wear your helmet each time you ride your bike sounds so much more proactive and positive than do not ride your bike without wearing your helmet. It's more empowering to people. So we want to address barriers and benefits in our message. If workers they can trust is an issue, and we hear that across the board, no matter what audience is telling us, whether they're caregivers of children or caregivers of older adults or spouses, we want to be able to trust you. So say you have workers you can trust and prove it with a credential. It's okay to say, we know having help you can trust matters to you. Our employees pass the most thorough background checks available. I mean, this gets at, we understand the barrier that you have. We have a benefit. We have something right here that we're going to address that, and we're doing this. And if the competition is not saying that they're doing that, there is an assumption that they're not, even though they very well may be. We hear and sometimes believe what is said to us or what we can read. And we want to make sure that whatever we do say, of course, is really what we're doing. We always need to have that integrity, that the service we're saying that we're promoting and that they're getting is really to the best of our ability what they're getting. Limit the number of messages to 3 or 4. Tell the readers only what they need to know. I think to be able to say, here is the problem, here is why it is important to you, and here is what you can do about it, all are very important to answer those questions where they are wondering, we're busy, and most of us don't have time to read a lot of information. And so we may be distracted by multiple messages. And we're getting more and more accustomed to those kind of distracting messages, to sound bites and website language and abbreviated text messages, things that have a character limit. And so sometimes we need to recognize that we can clearly state the problem, why it is important, and what we can do about it, and take the words we need, but don't add too much. So how will you reach your audience? How do they like to receive information? We talked earlier about barriers like access and convenience. They are real challenges in the health and human services work we all do. I think sometimes it's a natural thing for us to be talking about marketing, and we'll say, oh, here's a great idea. We can do a billboard, or we can do a movie theater ad, or we can put an ad on a pharmacy bag. And you know what? That might be a great idea. It might be the perfect channel. But one of the things we noticed, we were talking about movie theater advertising. This is the ads that are just there to read while someone is waiting in a theater before the movie actually starts. And, pretty inexpensive way to advertise, way to meet, get to a lot of people. And they may be great for friends and family of coworkers, or coworkers of caregivers, or adult children in the early stages of caring for aging parents. But they wouldn't be great for full-time caregivers. Most likely, they're not in watching a movie unless they're already having enough supports and services that they can be out, and we certainly hope they can be. If we think about when they are thinking about caregiving, it is likely when they are in the midst of a caregiver activity, like at a doctor's office or those regular caregiving errands. They may also be thinking about it in those quiet moments when they are worried, tired but can't sleep, or seeking peace in some kind of a restorative activity. And so when you think about that, where and when are they already likely to be thinking about your issue? These are the times that we try to come up with channels and messages to meet that. So further, a little bit more on how do you reach your audience. Can you go where the people are located? Can you reach them at a schedule that is convenient to them? And then is something happening in the social environment onto which you can piggyback? One of the things we're trying to do here in North Carolina with our evidence-based programs and our Aging and Disability Resource Center efforts is to cross-market our services to the people who access them at any point. If you are a caregiver, for example, who was able to participate and enjoyed your participation in the Chronic Disease Self-Management Program, for example, you may also find healthy ideas to be beneficial or vice versa. Are we taking that opportunity to tell participants in one program that we have something else that might be beneficial to them? If you call a county social services office, maybe to inquire about a home-delivered meal for your mother, are you also at that point given information about the Family Caregiver Support Program or other caregiver supports for you? Or maybe something that's available through another partner. We are part of huge systems, and marketing is not just directing your efforts at the consumer. It is about identifying others in the system as target audiences on their own and being clear and concise about a desired action for them as well. And as I show you the framework, I'll finish and show you how we have targeted some of these other audiences. All right, so here's the framework. We're almost complete here. The framework as we adapted it through the, from the Academy for Educational Development is these 3 channels at the top. So we have target audience, behavior, determinants, barriers, determinants, benefits, messages, and channels. This is how our Public Health Division and our Lifespan Respite Advisory team adapted this framework. The goal is to complete the table for each target audience identified. And for most of us, this is a new way of looking at marketing. In our experience, we had to practice a little bit before we got in the swing of it. Our advisory team worked down the columns a few at a time and then went back and fine-tuned across the rows. I like to use the middle column, which we put in to try to explain it a little bit better, the middle row, I'm sorry. We will help a target audience to take a specific observable action under certain conditions by removing barriers to action, by showing benefits to action, using messages that address specific barriers and benefits through these communication media. We all relate to different words. We all relate to different ways that they're explained, and so we just tried to add to explain this a little bit better to our 40-plus people that were working on this in our advisory team. So here's an example of one that's completed. When we first got together to brainstorm potential target audiences, we came up with 21 target audiences that we felt like would be important for respite. And so these were not just audiences of people who would consume respite themselves, but others who were in a position to refer and share and work on behalf of respite. So this target audience is older adult spouses who are caregivers of a person with dementia. Now notice this is pretty specific. It could be even more so. You could even go to in rural areas or in metropolitan areas, depending on where you felt like you need to further segment your audiences. But this is taking a specific caregiver situation, dealing with a specific diagnosis in a specific age group. Now what we wanted them to do for this particular activity was to call their local area agency on aging family caregiver support program resource specialist. In North Carolina, we have one of these at each of our AAAs. We could have also told them to call the Alzheimer's Association. We could also tell them to call our Duke Family Support Program. Whichever partner that we are working with, we can do that. We certainly want to make sure that whoever we're sending them to is prepared to receive them and on board with the plan, of course. Now, a determinant for a caregiver, why aren't they maybe calling? We hear over and over again that caregivers are not self-identifying. I think one of the great points that I took away from the Lifespan Respite Conference in Baltimore this last fall was when Jill Kagan talked about her work and Family Caregiver Alliance work to say that we know that caregivers are not self-identifying, so why don't we just assume that they're not, and we accept that as a barrier, and what can we do knowing that that barrier exists? And so we just accept that they're not maybe going to identify that they are a caregiver. Other barriers that this particular target audience, maybe they're feeling like only I know best what he or she needs. We're a team. No one else gets involved in our marriage. We've heard these things. We've heard these things told to us. We hear it in when we're starting to do services and when there's questions or concerns as things go forward. So what's the benefit? Better health for their loved one, more energy to focus on their loved one, free or low-cost assistance where you are in charge. I mean, this is an important thing. We're coming in, we're stepping in as outsiders to be able to offer a service that we think will be helpful and hopefully will change outcomes and allow them to be able to continue in their caregiving role for a longer period of time or to do that more effectively or to be less stressed in that situation. But ultimately, they are still in charge. And I think that's an important thing to be able to share because we know it's a concern. Some of the messages that came from this is help is not a four-letter word. Running on empty, let us help you refuel. You're doing a great job. Call us to help you keep it up. These are the messages that after we developed through all of this audience and this process that kind of came out from that. And then our next step is to further develop all of the wording that will accompany this. Now think about where we would show this. Where would we want to have the messages that we're using for older adult spouses who are caregivers of a person with dementia? We think about where they are. We're thinking about, those phrases, those things that we talked about on the previous slides. Where are they likely to be? Where are they receiving messages? Where are they already at? They're going to doctor's offices. They're taking their loved ones for appointments. They might be participating in a faith community. They might have a chance to be able to listen to something on a radio, or they are picking up prescriptions for their loved one. All of these things are possible channels that if we are complete in our messages and we're identifying what benefits are possible for them by accessing our programs or our services, they will be able to take an action that we have specifically told them what we wanted them to do. Now the thing with the channels, physician prescription pads, for example, we definitely think that's a good way. We know that the faith community, the medical community, has great credibility. A lot of caregivers listen to that. But you also need to be sure that physicians and faith community leaders are an audience. They, in their own right, if we're using channels that rely on others to be successful, like these physician practices or faith communities or pharmacies, they too must be a target audience. Your desired behavior for them is to share the pass-along card or refer their patients to community services. So as you go through one audience and get to your channels, it will usually prompt you to figure out, do we have an audience? Have we also developed the audience for the referral network? Our very last, another sample that I have, and it's our last one. We have several that we're working on, but I included 2 here in this presentation. Parents of children with special needs. Give respite a try. Schedule the service through a local provider. Same thing, they're not self-identifying as a caregiver. They were identifying as parents. A really touching insight for us was their overwhelming desire to enrich the life and long-term future for their children. So we're trying to tie respite for them to an independence and social or educational opportunity for their child. Parents told us this was important even if their children were now adults. And so that's sort of what got to the messages of it's an independence opportunity for your child. These were some benefits. More energy to focus on your child. Assistance from people you can trust. Time spent away can be spent making long-term plans for your child. I've really liked the messages that came out. Every parent needs a break sometimes. Why not you? Fewer timeouts can come from more time away. You know, everyone wins. Take a break for the family. You know, these are starts, and like I said, I know we have more work to do in developing the full message that will accompany kind of this headline approach, and looking at where they are. Similar parenting blogs, late at night looking for information on a website. Pass-along cards also, brochure for early intervention centers where a lot of people are receiving diagnoses or assistance early on in the process. All right. I very much appreciate the opportunity to talk to you about this. I think one of the things that we've really enjoyed about this process for us here in North Carolina is it gave us that method for brainstorming and group engagement. It was certainly a process that we could go through. We have quarterly meetings with our advisory team, and we worked on this through 2 meetings, and now we're at a subgroup finishing up and looking at developing the products and the distribution channels. Caregiver input has been key. It really caused us to slow down and not rush to messages or channels, which are really important. And like I said, we're now working on fine-tuning those written pieces and media channels, and we'll go to that design and distribution phase next. And hopefully, we'll be able to have some successful outcomes, and I know many of you are also doing similar processes and have come up with some great things. It's an exciting time to be in this field. It's an exciting time to see what we can do. And so I will appreciate any comments or questions that you might have. I know it looks like we're about at our very end of our time, but I'll pass it back to Jill. Thank you very much.
Thank you, Alicia. I thought that was just really wonderful, and I hope it encourages us all to really slow down and go through this deliberative process as we develop our messages about respite. Did we have any questions, Emily?
Yeah, I had a couple. Robin asks if there's a way to get a copy of the Behave framework.
Now, we don't have the original one that the Academy for Educational Development did. The version that we adapted is the one we've been working on. So as far as separate from the slides, I guess we could post the version that we adapted. But I think the full, complete version you would want to get from Academy for Educational Development.
You should have received a link to the PowerPoint slides that you can, where the framework is embedded in those slides, and you should be able to, download and print that off yourself. If you don't have a copy of the PowerPoint slides, let us know, and we'll send that link around again. Any other questions?
Yeah, Susie asks, your framework looks more at internal barriers. How do you approach external barriers?
Well, I think our external barriers, where we, by involving the partners that are involved, I would say those partners that we know about. is the first place to start. The external barriers, for example, like your access, or maybe we're setting up an external barrier for someone. And I guess I look at external even being organizations outside of, for example, our state aging and adult services division. How would I explain that? By looking at external barriers, we can get to them sometimes through a survey. We can get to them. We want to have all of those outside partners on our advisory teams or on our committees where we're looking at what is it that caregivers are trying to access. I think by stepping back and looking at what is the process that your caregivers are going through from the time that they are entering a system until the end of that system, what barriers are they encountering? That's one way to look at a small snapshot of it. Another way would be to go even beyond that and try to find out where are they entering before they, not entering, but where are they seeking services outside of being able to find respite. They may be accessing them through an external group like a group in a faith community, or maybe they're looking for services or help within a small family or neighborhood arrangement. Are there ways that you can try to get into that level and understand what are the barriers that are moving people forward? I think we saw one of the things that our Respite Care Coalition in North Carolina here is doing is to talk to various cultural groups and to try to identify why is it that you access services and why is it that you don't. And so those external barriers that may be coming from organizations or something cultural or something community that don't necessarily involve us, we're able to look at it from that perspective. So it's asking a lot of questions and trying to come up with a timeline, a system where people are accessing these. And I'm sorry, I know I didn't explain that very well.
Tina asks, how often should you call on doctor offices to create a relationship?
You know, I don't know that there's necessarily a perfect way to do it. One of the models that we have seen successful, you know, we look at pharmacy representatives, people that are from drug companies, essentially. And they can get into physicians' offices, and they do a great job of that. We have a couple of medical groups here, physician practices, that are doing some work specific around Alzheimer's and dementia outreach and better diagnosis. And they've basically adopted the pharmacy rep model. They said, we go in, you know, we stop in often, we bring them things, we're very friendly, we are very professional in our approach, and they've felt like that has been very successful for them to treat their interactions with a medical group as the drug reps are doing. And if you have seen that probably in your states, it's a good model to follow, very traditional marketing model where they're dropping in on a very regular basis. But I don't know that there's a certain amount of time. Certainly you want to be there and giving them something of value. And if they're seeing that what you're doing is valuable, they'll welcome you back.
Trina says, you talked about trying to reach people when they're already thinking about this issue. What are you doing to try to reach caregivers in those quiet, reflective moments or when they're directly dealing with care?
And I think this is where those referral partners are really key. Have you prepared a physician, for example, to be able, at the time of an Alzheimer's diagnosis or at the time of when a family member is coming in and saying, you know, I'm really a little overwhelmed, have you prepared them in advance to be able to know what to do and to share that information with a faith community contact? Is there something that is part of that network, part of that group where people know to go and talk to? Is it, in North Carolina we have a lot of volunteer organizations and a lot of outreach from our faith communities. And one of the things that we're trying to do is to really connect and prepare those volunteers who are one-on-one with older adults, who are one-on-one with families with children with disabilities. And we're trying to prepare them to be that person that is available to talk to to do resources and to say, you know what, there's a program that I've heard about. You might want to give it a try. This is what I know about them. And so it goes back to that phrase of trying to get down to your audience of one as much as possible. If we can help look at the family and friends around the caregivers, we're able to be sharing the information when they need it, when they're not going to call us, when they're not going to know to call us or call a particular provider, but they do trust their friend. They do trust someone in their faith community. So we want to be able to get to those credible resources and provide real and helpful information.
Any more questions, Emily?
That's all I have at this point.
Well, that's wonderful. Again, if you have additional questions that you think of once you disconnect from the webinar, feel free to email them directly to me. As you can see on the slide, my email address and my phone number, and we will pass them on to Alicia or try to answer them jointly for you. But thank you all very much for taking the time today. I thought it was a very helpful webinar. Again, I urge you to stay in touch with us, and you'll be getting some follow-up information from us about the archived webinar and some additional resources. So again, thank you for participating, and we'll let you know about our next webinar. Thank you, Alicia, very much for a great presentation.
You're welcome. Thank you.
Thank you all. Bye-bye.